Hi, I'm Mary Jane Minkin, and I'm an obstetrician gynecologist, and we're here today to talk about gynecological issues for cancer survivors. Unfortunately, there are way too many people being diagnosed in this country every year with cancer. The great news is that many of these folks are surviving their cancer and leading normal, healthy lives afterwards, and that's fabulous. One of the issues that young women particularly have to face is issues for preservation of fertility after their cancer is treated. For many, many years, we've known that young men who are unfortunately diagnosed with cancer and have to be treated with various chemotherapy agents may lose their fertility. We've known that for years, but the good thing we've been able to do for many years is to obtain sperm samples from these young men before they get their chemotherapy, save the sperm, so once they're cured of their cancer and they grow up, that they can be able to be fathers and have normal families. Unfortunately for young women, this opportunity was not available until fairly recently. However, particularly in the last 5 years, that a new technique has evolved to basically be able to save eggs from young women who unfortunately are diagnosed with cancer, are going to have chemotherapy, and may be affected by chemotherapy making them sterile. And we now have the technology to be able to take eggs from these young women, retrieve them, freeze them, and save them for after their chemotherapy. And then when they grow up a bit and want to get married and have kids, that they will be able to do so. And this is a fabulous new technology that many people are unaware of. Now, some of you may have heard about this and have thought, oh, this is a technique that's really for women who want to have careers and preserve their fertility, save their eggs, and then when they're much older, have a family. And it can be used for those folks. However, the technology was really developed for young women who are unfortunately diagnosed with cancer, are going to be undergoing chemotherapy, might lose their fertility, and this is a fabulous way to preserve their fertility. The most important thing is that we need to get the word out there. So if you are a family involved in this, please make sure that you talk to your oncologist, talk to the family gynecologist, and get the young woman in contact with a reproductive endocrinologist who will get this underway to save her eggs. If not, you can certainly contact the Society for Assisted Reproductive Technology to find some reproductive endocrinologists close by that can help you with this. The important thing to realize is that most young women who are diagnosed with cancer, you do have time available, the few weeks necessary. It doesn't take a long time to be able to mature some eggs and obtain these eggs and freeze them successfully before the young woman is treated with chemotherapy. So this is a fabulous technique to be aware of, and we really are all trying to get the word out to young women who are unfortunately being diagnosed with this devastating diagnosis, to know that there are options for them to preserve their fertility for after they are cured of their cancer. So again, if you do know somebody in this circumstance, please share this information with them and save some eggs for these young women. Bad news is that there are still way too many folks in this country being diagnosed with cancer every year. The great news is we have far more cancer survivors than ever before, and a lot of excellent new therapies are out there, and women and men are surviving with much greater frequency than they had previously. However, post-cancer therapy, there are a lot of problems that women and men experience as far as issues, self-image, and issues of sexuality, intimacy, and for the women, menopause. And I'd like to spend a few minutes talking about some of these issues. The treatment for cancer itself can be very devastating for many folks as far as things like body image. Surgery to remove certain body parts can be a very, very emotional issue. Surgery itself can be a very stressful situation, just going through surgery and the attendant fatigue and things of that nature. And then after surgical interventions, many folks are treated with chemotherapy or radiation therapy, which can have further effects on sexuality, intimacy, and menopause issues. Chemotherapy and radiation therapy may push women into menopause if they were premenopausal, or if they were indeed on some hormonal therapy. Many times the hormonal therapy is stopped. And indeed, radiation therapy can have an effect of producing scarring on certain parts of the body. For example, a woman who has radiation therapy for colon cancer may get involvement of the vagina just because the vagina sits right on top of the area that's being radiated. So these are all problems that folks can face, and it's important for women to to realize this, and it's important to be in touch with a good gynecologist who can help women deal with these issues and conquer them, because they really can be taken care of. The other issues that are out there to realize are the fact that with most cancer diagnoses, the hormone of estrogen is not involved. Indeed, most cancers are not what we call hormone receptor positive. People with leukemia, lymphoma, lung cancer, bowel cancer. These are all cancers that are what we call not estrogen receptor positive tumors. If a woman is diagnosed with one of these cancers, is treated successfully, but is now in menopause and dealing with issues of sexuality, intimacy, or menopause after the therapy, most of these women can be quite effectively treated with hormonal therapy, which is very, very effective and very easy to use for most of these women. And indeed, do not hesitate to talk to your oncologist and gynecologist about coming up with a plan to treat you. A couple of slight differences that folks may find, for example, if there is scarring produced by radiation therapy, many folks will use a topical therapy, say to the vagina, to help improve the tissue, but it's readily available and quite safe for these folks. For some women who've had a cancer diagnosis, there's some concern about blood clot formation, and in some of these women, we may recommend a transdermal estrogen instead of an oral estrogen, but these are relatively small problems, and most of these folks can be very, very well treated. So indeed, for a significant number of cancers, estrogen isn't even a problem and can be used quite readily, and most people don't realize that. Now, let's talk about another area which may surprise some folks. In women who are diagnosed with gynecological cancers, cervical cancer, uterine cancer, ovarian cancer, in the vast majority of these women, estrogen therapy can be quite safe. Both topical therapy for the vagina to help for vaginal dryness or scarring issues, and systemic issues, things like hot flashes, night sweats, can be very readily dealt with by systemic estrogen therapy. Although it may sound sort of surprising that these women are good candidates for estrogen therapy, they are, and it should be considered and discussed. And this is something appropriate to discuss with your oncologist and your gynecologist, and working together, they can help you come up with a plan to make you feel better.